Hello and welcome to APHA ASP's Operation Heart's blood pressure training video. As many as you may know or may not, cardiovascular disease is the #1 cause of death in North America. Nicknamed the silent killer, hypertension is a major risk factor for multiple diseases such as cardiovascular disease, renal failure, stroke, etc. However, with a proper diet and exercise, moderate salt and alcohol intake, and checking your blood pressure either at a health fair with us or at home, many people can assess their risk for the disease and prevent it. In the following video, we'll be showing two different blood pressure screening techniques, one manually with a blood pressure gauge and a stethoscope, and an automated machine that you can find in your local grocery store. Following the two videos, we will be showing you the JNC7 guidelines as well as counseling points that you can go over with your patient following the screening. Thank you.
Before getting started, introduce yourself and let the patient know which screening you'll be performing.
Hi, my name is Michelle.
I'm Caroline.
I'm a student pharmacist and I'll be checking your blood pressure today.
Checking a patient's blood pressure on a certain arm may cause pain if they've had injury or a stent placement.
Is it okay if I use your right arm?
Yes, that's fine.
Alright, great.
Have the patient relax for 3 to 5 minutes before taking their blood pressure reading. Make sure that their back is supported against the chair and their feet are flat on the floor with their legs uncrossed. Support their arm at heart level with the palm facing up. Have the patient roll up their sleeve or remove their jacket when necessary. Keep in mind that sleeves rolled up too tightly may create a tourniquet effect. When placing the cuff around their arm, make sure to align the tubing and the arrow with their brachial artery. The bladder of the cuff should encircle at least 80% of the patient's arm circumference. For auscultating blood pressure, leave about 1 to 2 inches between the cuff and the bend of the elbow. Do not secure the cuff too tightly. You should be able to fit your fingers in between the cuff and their arm. Before auscultating a blood pressure, you will need to find their palpable systolic. To do this, use your index finger and your middle finger and place it on their radial pulse located on the patient's wrist. Once you find the patient's radial pulse, you can begin to inflate the cuff. You want to inflate this cuff until you no longer feel the radial pulse under your fingers. That reading is their palpable systolic. Deflate the cuff and wait 1 minute before auscultating the patient's blood pressure. You may need to adjust your stethoscope in order to use the bell. Ensure that it is aligned with the flat metal surface in order to open up the bell. And make sure that the earpiece of the stethoscope is pointed away from you. Next, you want to place the bell of the stethoscope on the patient's brachial artery. You can ask the patient to flex their arm to help you locate their brachial pulse. You'll want to locate the brachial pulse about 1 to 2 inches above the bend of the elbow for stethoscope placement. Now you are ready to auscultate the patient's blood pressure. Place the bell on the brachial artery where you palpated. Inflate the cuff 20 to 30 millimeters mercury above the palpable systolic reading that was obtained earlier. Once that point is reached, slowly deflate the cuff at a rate of 2 to 3 millimeters mercury per second. As the pressure is released from the cuff, the blood will begin to flow back into the patient's artery. At this point, the sounds of Korotkov can be heard. The pressure at which the sound is first detected is the systolic blood pressure. The cuff pressure is further released until no more sound can be detected at the diastolic blood pressure. Take note of the measurements that were obtained. It's important to go over the reading with the patient as well as healthy lifestyle changes.
Next, we'll be showing you how to take your patient's blood pressure using an automated machine. Place the cuff on your bare upper arm 1 inch above the bend of your elbow. Make sure the tubing falls over the front center of the arm so that the tubing falls over the brachial artery. Pull the end of the cuff so that it's tight even around the arm. You should place it tight enough so that you can slip 2 fingertips under the top edge of the cuff. To get started, wait a moment, then press start. Remain still and quiet as the machine begins measuring. The cuff will inflate, then slowly deflate so that the machine can take your measurement. When the reading is complete, The monitor displays your blood pressure and pulse on the digital panel. If the monitor doesn't record a reading, reposition the cuff and try again. Rest quietly and wait about 1 or 2 minutes before taking another measurement. Record your numbers either by writing the information down or by entering the information onto a health record. If the patient's blood pressure is above normal levels, you may want to go over some risk factors that they may be subjected to. Having a family history of high blood pressure, hypertension, and cardiovascular disease greatly increases the risk, as well as being older in age, being male, lacking physical activity, having a poor diet, and not monitoring their salt and alcohol intake. By controlling a lot of these lifestyle events or lifestyle circumstances, a patient can greatly reduce their risk for hypertension.